much what happens, at least for women, it's more obvious than it is for men. As women go through menopause, men also have andropause. It just seems to be a big part of our society right now because of how hard we drive ourselves, how many stimulants we depend on, how many additives are in the food, the quality of our food. All those things go into throwing off our endocrine system, changing our nervous system, you know, the whole interrelatedness of systems. And so I think that even though life, you know, people are living longer, I'm not sure that the quality of our life is that much better. And I think that
I mean the quality of health.
I'm sorry, quality of health is not that much better. And I think that really an ideal demographic, I mean, gosh, every demographic has ideal components to how they would benefit from the TheraVibe, but probably 50 and over, and would, you know, whether in retirement homes, you know, people that just can't be as active, right? So when you get to that over 50, your joints tend to start to tighten up. Connective tissue tightens. You lose flexibility, lose mobility. It takes more energy to actually make us walk or to do any physical activity. So the other thing that happens is blood vessels start to stiffen. So then you don't get the same elasticity. So it takes more effort on the part of the, you know, the heart to move blood through the vessels. A greater dependency on muscle function to move fluids through the body is a factor. So the TheraVibe really assists with all of those things that just happen with age.
Would you say that because this stimulates your lymph system and improves the detoxification of the body, that all of your organs are able to work a little better?
Yeah, absolutely. So that detoxification is a thing that slows down with, you know, stress on the liver, you know, poor mobility, movement through the body. So detoxification, also respiration. Our lungs don't have the same elasticity. So anything that's dependent upon elasticity is compromised. So the TheraVibe is fantastic for assisting breathing. Everyone that gets on the TheraVibe, there's a certain frequency that it's on the machine where people are able to breathe deeply. A lot of people want to just vocalize because it just opens up, you know, the respiratory pathways and, you know, the bronchioles, the lungs, the larynx. So it's really an interesting thing to see that happen. So let's see some of the other things that are compromised. Okay, bone. Oh my gosh, definitely. So with age comes more demineralization of the bones, and they know that exercise is a critical part of increasing bone density. So the TheraVibe serves to augment.
Talk about some of your. It's nice anecdotal. Talk about some of your stuntmen and how their bone structure is different.
Right, well that's true. That's really interesting because I work with a lot of stuntmen and they take so many impacts that their bone density is greater than normal. I actually have one stuntman that had to have an ACL reconstruction and his bones were so dense that they couldn't screw the conventional screw in to hold the ligament in place. So it obviously shows how impact and vibration is a critical part of bone density development. So TheraVibes is a critical part of bone density development.
One thing I think it's important to qualify in all of this is it's not a panacea. It's not a silver bullet to fix all things. So if we're talking about demineralization and decreasing bone density, absence of exercise is not necessarily the whole picture. There's a hormonal component to it, all sorts of contributors. It could be diet. So you know, you need to look at the whole picture of health and address all of the shortcomings. And exercise or resistance exercise, that impact and that loading on the bones that TheraVibe provides in a more efficient way is part of that whole picture. But and I always, you know, when people talk to me about this and I hear that, okay, they want it for bone density, I'm always mindful to say this is one part of it. You know, don't ignore everything else that could be wrong that's contributing to that condition. And if you do all of this together, then you're going to get the maximal benefit. But, you know, we tend to, we condition to look for a single, not necessarily easy, but, you know, okay, what's the fix? And it's very seldom the case. It's usually, you know, multiple factors. So
that's so critical to mention.
So, you know, that just in saying how it helps with bone density, it helps for that aspect of developing bone density, the physical loading on the bone. But obviously, it's, you know, one still needs to address through diet and lifestyle and any of those other shortcomings that are contributing to that as well.
You know, that brings up such a important factor, because when people break their feet, whether it's stress fracture, things like that, and they put the boot in, it's so frustrating that, you know, to have the TheraVibe and actually have people come in on a daily basis, I'm sure that would accelerate bone healing, because it's just wrong that they're put in this boot. And I try and, you know, get them out of it as soon as possible.
Well, and also peripheral circulation is most, you know, it gets worse as you get towards the extremities, feet especially, and blood and lymph movement are also important contributors to accelerating the healing process. So